What would it even mean to deauthorize a vaccine or even just to pull back on vaccine mandates? How exactly would that work? And what would people be at risk of afterward? Joining us now to explore that, senior national correspondent for HuffPost and author of The 10-Year War, Obamacare and the Unfinished Crusade for Universal Coverage, Jonathan Cohn. The dean of Brown University's School of Public Health and former Biden White House COVID-19 response coordinator, Dr. Ashish Jha, and New York Times opinion columnist David French. So, Dr. Jha, I'm going to begin with you on that. If say RFK Jr. does get confirmed and he's able to put people in place that also are skeptical of vaccines, to put it mildly, if he wanted a vaccine revoked, taken off the market, what's the process?
Yes, first of all, Katie, thanks for having me here. Look, there are a lot of things that the HHS secretary can do, and he is putting his people in key positions across the agency. He can put pressure on the FDA to revoke the authorization of the polio vaccine, the measles vaccine, any vaccine he wants. One of the things that he can do quite easily is gut the childhood vaccination program. By the way, half the kids in America get their vaccines through this program. So even if he doesn't revoke the vaccine, he can make it much, much harder for kids to get those vaccines. And the consequences are going to be that we're going to have a lot more kids getting sick, a lot more kids dying of things that we thought were in our rearview mirror, not things that we thought we would be battling in 2024 or 2025.
Jonathan, can you expand on that a little bit, just the process by which you would make it harder to get one of these vaccines?
Yeah, I mean, he has a secretary of HHS, Robert Kennedy, would have all kinds of levers to influence what vaccines are given or required. And there's a whole range of things. So first of all, there are advisory committees throughout HHS that do things like set a recommended vaccine schedule or decide what Medicare and Medicaid are going to reimburse. As secretary of HHS, he would have the ability to take people off or put people onto those committees. He would also, for example, be in a position to decide how HHS enters in litigation over vaccines. You know, there's a ton of lawsuits out there all the time about vaccines. HHS routinely weighs in these court cases on behalf of vaccination. If HHS does not weigh in, those are harder cases to win. And by the way, a lot of those cases are being filed by a lawyer who is now one of Kennedy's top advisors on these issues.
In talking about RFK Jr. today, President-elect Trump said something that just confused me, and I'm hoping one of you can help me understand it. Let me just play what he said about RFK Jr. and alluding to the skepticism that he has surrounding vaccines.
I think he's going to be much less radical than you would think. I think he's got a very open mind, or I wouldn't have put him there. He's going to be very much less radical. But there are problems. I mean, we don't do as well as a lot of other nations, and those nations use nothing. And we're going to find out what those problems are.
What is he talking about, Dr. Jha? We have a lot of problems and a lot of other nations, and those nations use nothing. It seems like what he's saying is we have problems because we have vaccines, and other nations don't have these problems because they don't have vaccines?
Yeah, so first of all, there's no country in the world that doesn't vaccinate their kids at all. I mean, there are definitely some very, very poor countries that cannot vaccinate sort of fully the way we are able to. Those countries have much, much higher rates of measles and all these other conditions, and their kids do much worse than us. So the issue here is, look, these vaccines have all gone through very rigorous testing. I think it's always fine to look at the data again and ask the question, is each one of these still necessary? That's a reasonable discussion to have, but that's got to be guided by evidence and science and data. Robert F. Kennedy Jr., unfortunately, is somebody who says he doesn't know that there are any vaccines that are safe or effective. He's going to have an enormous impact on what happens to the vaccine program, among other things, for our country.
And folks, if I've got to interrupt you, I'm so sorry. We're waiting for the Madison, Wisconsin police chief, Sean Barnes, to give us an update on the school shooting, the other major story that we're covering out of Madison, Wisconsin. We're going to go there when it begins. He should be close. And David, I want to sneak in at least one more question to you, and this is regarding Republican senators. You heard those strong words from Mitch McConnell regarding the polio vaccine. He had a brush with polio as a child. Do you expect that there are going to be Republican senators who are going to say, hey, maybe this is a bridge too far for me?
I think it's very possible. And I think what we have to do is remind Republican senators that RFK's power is going to extend beyond the legal mechanisms we've been talking about. A lot of folks have a lot of faith that bureaucratic inertia will sort of block the most radical elements of the Trump program. But the reality is RFK has power beyond just the legal levers. He has the power of the bully pulpit. And he's going to get out there and he's going to constantly undermine American faith and confidence in life-saving vaccines. And that's actually something I worry about as much or maybe even more than some of these legal maneuvers, because you undermine that trust enough, you're going to see many more parents refusing vaccines for their kids. You're going to see all of these secondary effects that we've talked about, perhaps even without legal reform or legal change. And so the senators need to know that RFK can do immense damage in that position, even if there are other sort of legal, institutional, bureaucratic checks on his ability to affect legal change. He can affect cultural change just sitting in that seat.
Dr. Shah, that's a really good point from David, just undermining public confidence. Yeah, I've got friends who are skeptical of vaccinating their own children, smart friends who are worried about it. What happens if there are now a number of parents who say, I don't really feel like I need to do this. Polio is not a problem. I shouldn't get the polio vaccine. MMR, not a problem. I shouldn't get the MMR vaccine.
Yeah, so first and foremost, one of the things that I've always loved about our country is that vaccine confidence was always actually quite bipartisan. I remind my friends that in 2019, the most vaccinated state when it comes to kids was Mississippi, and one of the least vaccinated states was actually California before it passed some laws to change that. This has not been a partisan issue. I worry deeply that we are making this a partisan issue. Unfortunately, what I think the consequences will be is we are going to see kids getting sick. We've already started seeing that with measles, with whooping cough. We're going to see kids getting sick, and unfortunately, even some kids dying of diseases that should be preventable. I worry it's going to take that to get action back on track. Obviously, we've all got to do everything we can to prevent that. But that is the concern I have, that until that happens, some people are going to be just sort of, lulled into complacency on this. No, you haven't seen polio. That's because everybody's getting vaccinated. We don't need to make polio come back.
Yeah. And Jonathan, just one last point on the bureaucracy of all this. We're talking about undermining public confidence. That's a risk. But what about the bureaucratic inertia, as David was saying, that people will just kind of shrug their shoulders and say, don't worry, the institutions don't move quickly enough for Donald Trump to do any real lasting damage?
Yeah, I think David was exactly right. And I would say we're already seeing that damage in real time. 2 hours ago when Donald Trump was speaking and that clip you played, and he's, I'm for the polio vaccine, but maybe we have some problems. That is a perfect example. There's a lot of people, they're going to hear that. They're going to say Donald Trump, who they trust, who is the president of the United States, introducing some doubt about vaccines. Maybe they're not that safe. And, because of that, fewer people are going to get vaccines. And you repeat that over and over again. That is how you get to a situation where we see the level of vaccination drop to dangerous levels. We see more outbreaks like we're already starting to see now, and we become a less healthy, more dangerous country.